Hi everybody, today we are going to learn about Creuzfeld-Jacob disease, also known as CJD. CJD is a rare, degenerative, fatal brain disease that affects about 1 in 1 million. It was discovered by Hans Gerhard Creutzfeldt in Germany in 1920 and later by Alfons Maria Jacob, making the name Creutzfeldt-Jacob disease. There are three main categories of CJD. The first one is sporadic, which accounts for 8 to 10 cases with no known trigger. It is when a normal prion protein spontaneously changes into a prion. The second type is known as familial or inherited CJD. It is when a person inherits a mutation in the gene that produces the prion protein. This inherited gene is a dominant one. And the third type is transmitted CJD, which can be further divided into two categories. Iatrogenic CJD, which is an infection that spreads from someone with CJD through medical or surgical treatment, and variant CJD, which is caused by the same strain of prions that causes bovine spongiform encephalopathy, which is also known as mad cow disease. A bit about the pathophysiology of CJD. Normal prion proteins are found in almost all body tissues. They are at the highest level in the brain, and PRP subscript C, which stands for correctly folded, as pictured here, has a high level of alpha helixes relative to the beta strands. In CJD, these proteins misfold, either sporadically or inheritedly, and they make the PRP subscript SC standing for scrapie, which is a different conformation with a higher number of beta strands due to the misfolding. These higher number of beta strands allow these prion proteins to stack on top of each other and aggregate, which allows them to build up and allows other proteins to stack with them. Once you get these aggregated groups of prion proteins, they propagate and multiply together. This causes the formation of plaques, leads to cell death, and affects the overall brain. The symptoms of CJD mainly affect the workings of the nervous system, and the symptoms rapidly worsen in the space of a few months up until the disease progresses to death. Early neurological symptoms include balance and coordination problems, slurred speech, numbness, and vision problems, and advanced neurological symptoms include muscle twitches and spasms, loss of speech and voluntary movement, blindness, and swallowing difficulties. Early psychological symptoms include depression, withdrawal, anxiety, irritability, and insomnia. And the advanced psychological symptoms include severe memory loss, confusion, aggressive behavior, paranoia, and inappropriate emotional responses. Diagnosis is usually based on a combination of medical history, symptoms, and a series of tests. These tests include MRI, EEG, lumbar puncture, and a tissue biopsy. However, the only definitive way to confirm CJD is through a brain tissue biopsy, which is usually performed post-mortem. Currently, there is no treatment or cure for CJD, and we are unable to slow the progression. The prognosis is a couple months to 2 years. However, treatment usually involves symptom control and management. Pain control is done through opiates. Pharmaceuticals such as clonazepam and sodium valproate are used in treatment of mood problems and muscle spasms. IV fluids and artificial feeding may be used later as the disease progresses, and eventually the patient will require 24-hour care up until death. Support for families can be hard to find for patients with CJD. The disease progresses very quickly and is also very rare, so there are not very many face-to-face support groups. However, the Canadian CJD Association holds annual conventions across Canada every year. This allows an outlet for families to meet other families who went through a similar experience with their loved ones. They also hold fundraisers and raise money to conduct research. Another good resource is the Alzheimer's Society website. They provide a lot of accurate information on CJD, on symptoms, diagnosis, assessment, treatment, and life expectancy, and provide an abundance of literature for the family to read. And finally, the CJD Foundation is aimed at family members of patients with CJD. They provide a toll-free number to call if you need support. They also include workshops for family members in coping with the disease and after death. Here's a quick video showing a family's experience with CJD.
This is a book all our scrapbooking friends made. Just love dragonflies. It's got the dragonfly.
For Kip Lavin, the warm memories of his 17 years with wife Michelle well up just as quickly as the tears of loss.
She's always had a smile. Her laugh was great. She was great. Really miss her.
In March of 2011, 42-year-old Michelle experienced a sudden onset of stroke-like symptoms, difficulty speaking, confusion, and odd movements. All tests came back negative and she was sent home, but Michelle was still struggling.
Everything was not working. She'd put her shirts on backward.
Within a few days, Michelle was back in the hospital to stay. Stroke and meningitis were ruled out. Kip says primary care doctors and specialists were stumped. And then, without the chance to ever say goodbye, his wife was gone.
40 days, I think, from the beginning to the end, it was done.
The diagnosis, Creuzfeld-Jacob disease, CJD. There is no treatment and it is always fatal.
We call rapidly dementing illness. That's something that affects cognitive skills, memory, thinking, behavior, and it comes on rapidly.
Mayo Clinic neurologist Dr. Alan Axemet says an abnormal infectious protein called a prion is believed to be the cause of CJD, actually creating holes in and around neurons in the brain.
It co-opts the normal protein and then it becomes a self-replicating or self-amplifying process, which essentially kills neurons and gets transmitted to other neurons in the vicinity.
Dr. Axemet says 90% of cases are sporadic, striking spontaneously without a known cause. The other 10% are familial, which was Michelle's case. Kip says that means their sons Cody and Devin have a 50-50 chance of developing CJD, a possibility he finds very hard to bear.
The normal person, if you knew you had it, you couldn't get married, you couldn't have kids,
Since CJD affects just 1 in a million people, research is slow to progress, yet that is Kip's only hope of erasing the long shadow cast by a dreaded disease. For Mayo Clinic News Network, I'm Dennis Doda.